So, hi everyone. Today I shall be addressing a very important topic, which is nutrition in pregnancy. My patients often keep asking me what to eat, what not to eat, how much to eat during pregnancy. This question is specifically asked by Lucille, and I'll be answering this in this video. So, the first thing is that how much should you increase your diet by during pregnancy? So the old women in the families, they will often tell the pregnant women to increase the intake of food to nearly double to what they had been previously taking. This does not hold true. Basically, you have to increase your calorie intake by 15% of what you were taking prior to your pregnancy. And this amounts to about 100 to 300 kilocalories of extra calorie intake per day. Secondly, you also need to increase the amount of proteins you are taking. Proteins are specifically important because they are important for building up the various tissues and muscles. Not only yours, but also your baby's muscles, tissues, placenta, your blood volume, everything is increasing during pregnancy. So to increase all that, you need lots of proteins. And by how much should you increase your protein intake? It is about 25 grams per day. So normal protein intake prior to pregnancy is equal to 1 gram per kilogram body weight. So if your body weight is 46 kilograms, it is 46 grams of proteins which you need to take. To this, you need to add 25 grams extra during pregnancy. Then you also need to increase the intake of various minerals. The most important ones include folic acid, iron and calcium. So let's talk about each one of them. Folic acid is important especially in the first trimester. And folic acid you should start taking right from the time when you are planning your pregnancy. So you should start taking folic acid in the preconception period itself. And it could be in form of supplements, folic acid supplements amounting to about 400 micrograms per day. Also, you should increase the intake of folic acid rich foods. The folic acid rich foods, they include green leafy vegetables, asparagus, Brussels sprouts, avocados, beans, chickpeas, orange juice, fortified breakfast cereal, lentils, etc. The second important mineral which you need to focus on during pregnancy is iron. Iron, as you all know, is an important component of hemoglobin, which forms an important part of your blood. So you need to increase the intake of iron in the diet, and you also require iron supplements in the dosage of 60 milligrams per day for at least 6 months. And this is the recommendation given by the WHO or the World Health Organization. And what are the iron-rich foods? They basically include the meat-based products, especially the red meat-based products, eggs, poultry, green leafy vegetable, lentils, dry fruits like apricots, etc. So talking about the next mineral, calcium, you need to also increase the intake of calcium. Calcium is important because it forms an important component of your bones as well as your baby's bones. So when the baby's bones are developing, the baby will take the calcium from your body via the placenta, and you may turn deficient in calcium. So it is important to take calcium supplementation. And again, the dosage as devised by the WHO is 1.5 to 2 grams per day. Again, this is started in the second trimester, 6 months, and also to be continued in the postpartum period or the period after the birth of your baby. So the sources of calcium include the milk-based products, all types of cheeses, all types of milk-based products such as yogurt, buttermilk. Eggs are a good source of calcium. Then fishes, specifically salmon, sardines, almonds, green leafy vegetables such as okra, kale, not really spinach, but okra and kale, they are very good. So another important thing is the time when you need to start increasing the supplements. So majority of women, they might be suffering from morning sickness in the first trimester, that is the first 12 weeks. So in the first trimester, don't focus at all on your caloric intake or your proteins or your supplementation. The supplementation which you mainly require during the first trimester is folic acid. You continue with that. No need to start iron or calcium during that time because you will not be able to take in. And also whatever you feel like eating, you eat during this period because you may not be able to keep in what you are eating. So don't worry about the caloric intake, don't worry about the protein content. If you like something sweet, take that. If you like something sour, take that. Don't worry about how much calories it'll be giving you or very few calories. If you like chocolates, have that. It's absolutely fine during the first trimester. Start worrying about your caloric intake, start worrying about your protein intake and intake of your iron and calcium from second trimester onwards, because or maybe towards the end of first trimester and beginning of second trimester. That is the time when usually your doctor will start with your iron and calcium supplementation. Also, what you need to remember is to avoid the intake of raw or processed meat, because the meat which is not properly cooked, it may be associated with the danger of giving you a disease called toxoplasmosis, which again is harmful for your baby during pregnancy. So avoid eating raw, uncooked or processed meat. In case you are interested in knowing more details and you want a one-to-one recommendation regarding exactly what diet, how much calories, how much mineral supplementation, what exactly should be your dietary plan during pregnancy, how much weight you need to gain based on your pre-pregnancy weight, then I am conducting a workshop between 28th to 30th April. So you are requested to join either my WhatsApp group, Let's Talk Women's Health, or the Facebook group. You can find the details of joining these groups in the description. And in the Facebook group as well as in the WhatsApp group, you will get the details about the workshop which is coming soon. So if you join that, you will get detailed information regarding your, not only just your dietary plans, you'll also get details regarding other complications like morning sickness, constipation, varicose veins, complications in pregnancy like bleeding, hypertension, gestational diabetes. So I plan to cover all these topics over 3 days. So thank you very much for listening to this video, and if you like this video, please subscribe to this channel and also hit the bell button to get the notifications. Thank you so much.